Minister Zweli Mkhize is visiting hospitals in the Eastern Cape as COVID-19 cases are increasing in clusters. More beds and doctors will be made available to assist with the outbreak in the province. Minister Mkhize says that the cluster outbreaks in the province need to be curbed. eNCA's Aviwe Mtila is in that province for us and joins me now live. Aviwe, what are the key challenges that people have told you in the Eastern Cape?
Well, Maseko, it's the resurgence of COVID-19 in the Eastern Cape that is the big worry. The Sarabadman region, as well as the Nelson Mandela Bay region, where we're at the moment, have been highlighted as the hotspots. Now, you'd understand that the super spreaders of COVID-19 have been highlighted as taverns, parties, as well as retail centers where people going in unchecked cause the spread of COVID-19. Of course, we are in Livingston Hospital now, where you understand the minister also touched on the testing turnaround time, saying that it takes too long for COVID-19 results to come back. You'd find that the hospitals are full, but not because there are lack of beds, but instead it's patients waiting too long in the hospitals to find out their results and be taken to the wards where either they're COVID positive or COVID negative. Something that the minister touched on. Let's listen in on that.
The second issue relates to capacity to test. The turnaround times should not be delaying as what is being reported, because we are not testing as much as we're testing during the surge. There has been a discussion since we got your report with the Director General and the CEO of the National Health Laboratory Services to increase the capacity for testing in your laboratories. This means that if you identify the issue as being that of staffing that is affected, that those two offices must deal with that issue and assist, so that there should be a much shorter turnaround time. Ideally, we work on a 24-hour turnaround time that allows PUIs to be moved immediately within a short space of time. The people are the persons under investigation need to be moved within 24 hours to either a COVID negative or COVID positive area, so that you can then deal with the movement of people. All the time when people say that the hospitals are full, they don't necessarily mean there are no beds. They basically mean that in the triaging area, you get blocked there because people are sitting there, lying there for 2 days, and therefore anyone who comes in can't be admitted, because then you don't know whether this one is positive or negative and which way they should go. And it's still possible that somebody can come and have symptoms and have other viral infections that's got nothing to do with COVID, and they need to be moved away to a safe COVID negative area.
Of course, Aviwe, workers would take the opportunity after finding out that the minister would be there to protest. What are they telling you about their grievances?
Well, they're right behind me, Maseko, coming out in fair numbers. In fact, they brave the rain here in Port Elizabeth, saying that at the fore of their grievances is better pay. They say that they're frontline workers, yet they're not being paid their due diligence. They're waiting for the minister to come out at any moment now, saying that while the minister is engaged with different people, the MECs and the different hospitals, they're not engaging with the unions themselves, and they demand that at least they need to be adhered to. In fact, it's a conversation that I touched on with Nabsal's regional secretary, who told me about not only the deaths but the infections of surgeons just today. Let's listen in on that.
The minister didn't engage with us as labor formations. We just heard last night that the minister will be in Nelson Mandela, in Livingston Hospital, without our knowledge. That is why you see us here today with our workers, because we've tried so many times to engage with the minister, but we failed. They don't care about us. They don't care about workers. As today, we've got 17 surgeons that tested positive in theater, but nothing has been done. They are coming here to talk sweet things inside, while we are crying outside.